I'm so excited to talk to you guys today about cannabis and concussions. I have stories of both a pediatric patient and a professional football player. So my name is Mbengue, and as founder and CEO of Trusted Cannabis, we teach people how to use both cannabis and psychedelics as medicine. Along with that work, we also formulated our own line of really high quality CBD products. And we're going to be talking a little bit about those today and kind of how one of them helped a couple of people with their concussion recovery. And we're going to get into the science of concussions. So buckle up. I'm really excited for this. So first, we're going to talk about my son, Samba. He's 8 years old. He was 7 when this injury happened. So back on a Sunday in January, February, he was standing on a 4-foot wall, and then he managed to fall backward, but then turned and face planted on the concrete. And he got himself a nice goose egg that we have pictured here. And following that, he was super tired and fatigued and confused. And he definitely was showing symptoms of a concussion. Then 2 days later, he was out playing soccer at recess, and then he fell kind of on the same side of his head and then was having worsening symptoms. He was having worsening vision that he said was kind of like closing in and getting more and more blurry. So we sought medical treatment to make sure that he didn't have a brain bleed. He had a CT scan and all of that was ruled out. So he was officially diagnosed with a concussion after that second hit, even though he was showing symptoms after the first hit. His symptoms were a raging headache, fatigue, sleep disturbance, and confusion. And he was he's 7, 8 years old, and he's a smart kid, and he couldn't count the number of fingers that I was holding up, which is really kind of terrifying as a parent to see that and witness that. So what we did was we started him on our Thrive XL formulation, which is a really concentrated cannabinoid formulation with CBD, CBG, CBDA, CBGA, beta-caryophyllene, and some other targeted terpenes. He was on about 300 milligrams a day total for the first couple of days. And then we started slowly weaning him down. And then as his symptoms improved, and then he was on maintenance therapy for a couple of weeks after that. So he was symptom-free by the following Monday, and then he was back out on the soccer field the following Wednesday. So just like a week, less than a week, that he had these raging symptoms. And you're going to see like how cool that is, because concussions don't typically recover that fast. So probably don't need to tell you guys this, but the potential consequences of head injuries. We have a 24% increased risk of developing dementia, and that's all related to the neuroinflammation that we're going to touch on a little bit later. We can develop sensory motor dysfunction, psychiatric disorders, anxiety and depression are a huge part of concussions. And then we all know about CTE, that a lot of professional football players develop later in life because they had many hits to the head. And there are currently no FDA approved medications for concussions. What happens to the brain during a concussion? So we were kind of taught that a concussion is like this contra coup action in the brain, where the brain is like hitting the skull and then it gets bruised on that part of the brain. But that's not actually what happens. Newer research points to a difference in the densities of the brain matter. So we have gray brain matter and white matter, and those have different densities. Think one is kind of like jello and one is like pudding. So if those are both in action and then hit something on impact, they're going to slow down at different speeds. And what that causes between the two sections is shearing and stretching of the neurons. And if you think of a neuron like almost like a silicone straw with thousands or millions of tiny holes in it, when that straw is stretched, those holes are going to open. When those holes open, sodium rushes into that neuron, and then it causes the neuron to fire. And when this happens to the millions of neurons in our brain at once, like on impact, that's when we see stars or potentially even black out after we get hit. So this is called the excitatory phase. And this happens, again, right after impact. Then following that is where we see a lot of the symptoms. This is phase 2, called spreading depolarization. So come with me along on this. So when all of those neurons are firing, they're releasing glutamate, which is an excitatory neurotransmitter. And what glutamate does is it binds to the neuron and it opens up the calcium channel. So then we have all of this calcium rushing into the cell. And what the calcium does is that interferes with the mitochondria in producing the energy that the neurons need. So the neurons can't produce the energy. So that's when we have like this metabolic mismatch in the brain. And that's why we see all of these symptoms, especially fatigue. Fatigue in the hours following is a lot because of this calcium and this mitochondria and this metabolic imbalance. And it typically takes about 2 to 4 weeks for this metabolism to balance out. Most people recover within about a month. About 70% of people recover in about a month. 30% of people can have symptoms for weeks, months, or even years out. Typical symptoms include nausea, headache, brain fog, fatigue, sleep disturbance, and there's a total of 22 in the DSM. So to have a concussion diagnosed, you only need 2 things. You need the initial impact, and then you need one of those 22 symptoms for a concussion to be made official. So following the concussion, this is the really important part. We also see this release of pro-inflammatory cytokines. TNF-alpha, IL-6, and IL-1B are the most important ones and the ones we see the most of. We also see this accumulation of lactate, again, because of this energy mismatch in the brain. We see an increase in oxidative stress and the free radicals that are bouncing around, causing injury and damage. And then we see impaired cerebral blood flow and cerebral edema. And if you get a second hit before that first hit has healed, that can cause catastrophic brain damage, sometimes permanent or semi-permanent. And that's why we wait so long to get our athletes back out on the field, because we want that first hit to recover. That's why my son should not have been playing soccer 2 days after he was hit. So when we look at neuroinflammation in the brain, we need to understand that a little bit of neuroinflammation is actually a good thing. That's good for immune surveillance. That's good for memory and development and learning. That's like the brain doing its job and maintaining kind of homeostasis. Is like this low level of neuroinflammation. However, with head injuries, and we see chronic and high neuroinflammation. And this can cause issues later on. We see neurodegenerative diseases, and we see social stress and anxiety and depression is all related to this neuroinflammation. And if you look at the specific cytokines, IL-1, IL-6, TNF-alpha, those are the same ones that are elevated in concussions. Those are the same ones that are elevated in Alzheimer's and dementia. And that's why those two often coincide, concussions and Alzheimer's, because of this neuroinflammation. And we currently have no medications that can tame down this neuroinflammation. However, cue cannabis, where we have amazing therapeutic potential. CBD, CBG, the combo of CBD and THC, interestingly, not THC alone, were all found to suppress those inflammatory cytokines, TNF-alpha, IL-1B, and IL-6. In vivo, of course, we aren't exactly doing, brain biopsies in live humans of this yet, so we have to rely on observational studies. So that's the therapeutic potential in decreasing neuroinflammation and those cytokines. All of our favorite cannabinoids, CBD, CBG, and the acids are antioxidants. So they're going to gobble up those free radicals that are bouncing around and causing damage in the brain. CBD and CBG can also help to regulate blood flow and enhance neurogenesis, things that we really, really need in concussion recovery that we don't have medications for right now. We do have a couple of observational studies showing that cannabis use is correlated with better outcomes. So one is a study of about 20 people. They split them into 2 groups. One was a cannabis using group, one was a non-cannabis using group, and they induced the subconcussive state by having these people head a soccer ball 20 times. And I think it's like really amazing that we can induce a subconcussive state that way. So what they did was they looked at a couple of different things. One, is the bottom graph on the bottom left. That's the NPC, or near point conversion. If you hold your finger out in front of your face and then bring it closer and closer to your nose, the point where that splits into two images is what they're measuring. So in a concussion, that distance gets longer. And what that is that's like a measure of ocular motor function, and that's impacted by concussions. So what they found was that cannabis users, both cannabis users and non-cannabis users, went up a little bit. However, the cannabis users kind of leveled out after 72 hours, but the non-cannabis users, that distance kept getting greater and greater as the days went on. And then what they also looked at was this graph on the bottom right is astrocyte activation. What that is, that's a measure of neuroinflammation. Cannabis users were low and stayed low. Non-cannabis users were high and stayed high. Another study done found that cannabis use was associated with lower symptom severity 3 weeks after injury. So we do have some evidence showing that cannabis use can help with concussion recovery. Then we have Gilbert's story. Gilbert Brown played for the Green Bay Packers in the 90s. He played 125 games, 15 playoff games, 2 Super Bowls. He won the 1997 Super Bowl. He's 52 years old. We met on a podcast and he agreed to try a couple of our products. And his symptoms were leg swelling, joint stiffness, joint pain, brain fog, and memory issues. He would get lost in a traffic circle and kind of had issues thinking clearly. He would leave his keys somewhere and have no idea where he put them. So he agreed to try the 2 products that we eventually combined into one, which is Thrive XL. And after about 10 days, he started to see an improvement in his symptoms. He started to see increased mobility. He was able to tie his shoes where before he couldn't bend down or bring his leg up to do that. He saw a decrease in leg swelling. He drives a lot from Michigan to Wisconsin for the Packer games right now, or during the season rather. And his legs would swell up, and he noticed a decrease in his leg swelling. He wouldn't get lost in the traffic circles anymore. He had clearer thinking and improved memory. So he had great outcomes with this formulation and with whole plant cannabinoids. And he had gotten, and we are decades out from his last game, and he was having symptoms, and those symptoms have definitely improved. I don't know that they have 100% resolved, but definite improvement. So in conclusion, we definitely need more research on cannabis and concussions. We definitely need access, and we need people across the country to be able to access whole plant CBD for concussion recovery. And then we need education on the provider level and then on the patient level. And then for everybody to be able to access this quality medicine in concussion recovery. It's imperative because we have no medications right now. And with that, I thank you.